requirement kicks in today for healthcare workers across the country and right here in the tri-state area. In the meantime, the future of New York State's mask mandate will be decided at a court hearing tomorrow.
And the new requirements and the legal battle comes as the number of COVID cases keeps dropping across the city. New York City Health Commissioner Dr. Dave Chokshi joins us live this morning with the very latest numbers. Good morning, Commissioner Chokshi. Always so great to have you on the show.
Morning.
Thank you so much, Hazel. Good morning, Dan.
Yeah, so let's get straight to the numbers. During the first week of January, we were seeing more than 40,000 new COVID cases a day. That's all across the city, but things seem to be trending downward. So where does the city stand right now?
Yes, I'm cautiously optimistic overall. As you pointed out, we were at a peak of over 43,000 cases on our 7-day average. And most recently, that number is below 7,500 cases. So we have made progress over the last few weeks. We still do have work to do because that is a high number. We're still at a high level of transmission across New York City. So we have to do the things that New Yorkers have done over the last few weeks to keep those numbers trending down.
Yeah, and specifically, Doctor, the data shows that Staten Island, Queens, and Brooklyn, they remain some of those hot spots that you talk about, right, with the highest number of new cases. Why particular in those areas? Are they low vaccination numbers? What are you seeing?
It's a confluence of factors, and we've seen this throughout the pandemic. Some of it has to do with mobility. Certain people have higher risk of exposure because they're just moving around more, either for work or for social gatherings. Some of it does relate to lower vaccination rates, and we do have to continue working on that. There are two particular aspects to this phase of our vaccination campaign that I want to emphasize. The first is for parents to make sure to get your children, anyone 5 and up, vaccinated. We've made great progress with our adolescents, but children 5 to 11, only 1 in 3 are fully vaccinated right now. Okay. And the second one is our booster doses. We're encouraging everyone, stay up to date. Make sure your immunity is at a strong level by getting your booster dose as soon as it's time.
Well, a lot of parents I'm speaking with are wondering, do you have any idea when there could be a vaccine for children that are under the age of 5?
Yes, I'm following this closely, not just as a doctor, but as a father, because I have a daughter under the age of 5 as well. And the indication that we have is that it will be as early as sometime this spring. It's going to take us a little bit more time for the companies to finish the studies that they have underway and then for it to get through the FDA process. So it's always important for us to make sure that a vaccine is safe and effective before we administer it. Yeah. So it will take a little bit more time.
And on that front of those vaccines for under the age of 5, is it going to be 1, 2, or 3 doses? Because yesterday there was some announcement by Dr. Fauci that it could be as many as 3. What are you hearing?
Yes, it will be at least 2 doses for the mRNA vaccines. That's Pfizer and Moderna. And it's more likely that Pfizer will move through the process more quickly, as we've seen for older kids as well. There is a possibility that it will end up getting authorized as a 3-dose vaccine, in part because the initial data from only 2 doses showed that the immune response was somewhat lower than we had seen for older age ranges. So that's why Dr. Fauci said what he did. We'll have to follow the data to see what it shows.
Good information.
And I'm assuming we'll have to wait to see if kids between 5 and 11 will need a booster shot as well. Moving on to a different, what's happening today, the new vaccine requirement for healthcare workers, it does go into effect today. So how many healthcare workers in the city are impacted by this?
Yes, well, first of all, I'll say I'm strongly supportive of this vaccine requirement. We've seen in New York City how effective they are. The vaccine requirements, there are 2. One is at the national level, and the other one is at the state level for healthcare workers. The national vaccine requirement for healthcare workers doesn't have much of an effect in New York City because we had already passed a mandate for healthcare workers earlier. But the one that requires healthcare workers to stay up to date, that's been advanced by the state. By February 21st, if you are eligible for a booster dose, you have to have received it. And remember, for our healthcare workers, this is about protecting them, but it's also about protecting the patients that we serve. That's why this is so important.
Are you confident in staffing levels that they'll remain okay during that timeline of getting those booster shots to stay up to date?
Yes, I am. And in fact, this will help with staffing because it will mean that less people will get sick. We saw, particularly during the Omicron surge over the last few weeks, our healthcare workers stepped up once again. I really want to thank them. We should all be grateful for what they have done. This is another step to help protect them and to help protect all of us.
Yeah, and Dr. Chokshi, we really want to get your take on this because we're expecting a ruling tomorrow on the state's mask mandate in schools. You're seeing what's happening on Long Island. So are the COVID transmission rates in schools low enough to make masks optional for students?
No, not yet, although I really look forward to that day when we are able to remove the mask requirement. But it's not quite yet. We still do have high levels of community transmission, as I mentioned. And remember, the fact that we have taken these precautions is what has allowed us to safely return kids to school. Yeah. So, we have to have a little bit more fortitude in the face of what I know is a lot of fatigue related to COVID. But these are the safeguards and the precautions that have worked, that have helped to protect our kids and school staff. So it's not time just to...
Yeah, briefly, before we get to the final topic here, I did speak to the governor of New Jersey, who said sometime this year he envisions masks being removed in schools. Do you envision the same timeline?
Yes, I hope that is true. It all depends, of course, on the conditions of COVID and what happens with transmission rates. And remember, look, this is all up to us. We have to take the steps, getting ourselves vaccinated and boosted, making sure that we're doing the things to reduce community transmission, because that affects not just the city, but settings like schools that are so important.
And Dr. Chokshi, before we let you go, I do want to get your take on a very important topic right now that is just dominating the headlines, and that's the role that hospitals are actually going to play in Mayor Adams' new blueprint to end gun violence that was unveiled this week. So what is that going to look like, Doctor, and where are the hospitals located?
Yes, well, as Mayor Adams has said, violence is a sea fed by many rivers. And so everyone has to do our part, and the health department is a part of his plan. Specifically, there are these programs called hospital-based violence interruption programs. This is about the fact that, trauma surgeons, emergency room doctors, they see the downstream effects of violence in our communities. And so the goal is to use that tragic moment as one that actually helps to interrupt the cycles of violence by forging community conversations and changing the dynamic upstream so that we actually have less violence and less victims.
Yeah, well, hopefully that will help, because some may say that gun violence is a pandemic in itself. Dr. Chokshi, thank you so much again for joining us this morning and for giving us all the latest information.
Of course, it's a pleasure. Thank you.